Well, welcome back, ladies and gentlemen, to FSD Pharma's channel, bringing innovative neuro and inflammatory disorder therapies to millions. Forefronting this, one of the founders joining us today, Sejan Saheed. Welcome, sir.
Thank you.
And always a pleasure. Always a pleasure to have you, man. Happy New Year. So I really want to kick this off a little bit into this new year. I kind of want to framework this just to give some broader focus to the new retail audience that might be checking this out. And first and foremost, you had huge accomplishments in the psychedelic space. I mean, in the first place, from treating inflammatory disorders to the acquisition of psychedelic company Lucid for treating MS and depression. Do you want to just briefly touch on some of the milestones you guys achieved in 2021?
So yes, we successfully closed the Lucid transaction in September, and with that, it's not really a psychedelic company. It's a biotech specialty biotech company that we acquired, which have two main compounds. One is for the treatment of progressive MS, and it's a new chemical entity which we have worldwide rights now through Lucid. And the second is a psychoactive compound, more of a psychedelic. So it's not totally a psychedelic company, and has some really exciting molecules that we are going to put in phase trials sometimes this year, hopefully.
Okay, so I mean, yeah, Lucid was a huge accomplishment for you guys. I mean, as we head into Q1 here, is that where the primary focus is going to be, or is there anything else you can offer insights to the investors on how you guys are kind of frameworking the start of this year?
So with Lucid, we also got a world-class team, which of scientists and people who are very familiar with the regulatory framework of how to get your compounds into FDA clinical trials. If you see, we have a world-class scientific advisory board. We have a regulatory board with people who have tremendous experience in all aspects of doing phase clinical trials. So we just not only acquired more compounds to mitigate the risk of only having one, we actually acquired a very, very talented team of world-renowned people along with it, who can accomplish. Yeah, we can accomplish our dreams through that.
So hopefully look forward to some of the updates as you guys head into the phase trials. Do you want to talk a little bit more about kind of the macroeconomic circumstances we're in here? I know depending on what countries you're from, the pandemic is still a huge forefronted conversation, which let's hope this is the last hurrah of it. And by the summer, we can finally get through this. But between that, I mean, we're talking about hyperinflation and interest rates. Are these things that affect these phase trials, or are you guys largely conditioned away from it, considering, I mean, it's not like you're heavily debted on the balance sheet. And I mean, do you want to just talk briefly there?
So yeah, for sure, the pandemic has its effects, but we are in a pretty good situation considering that we have over $40 million on our balance sheet, and we have an asset which we have listed for over $20 million, and we hope to sell it in the first quarter of this year. And if that sells, then we'll have more non-dilutive cash coming in. With that, we'll have a runway of currently we have a runway of about 2 years. If we sell that asset, we'll have a runway of about 3 years. So we are not in a position that we have to worry too much about raising cash or getting our goals achieved, what we have in line. 2022 will be a very exciting year for FSD, because we'll have 3 assets going into phase trials, hopefully in this year. PEA, the team of under the supervision of Dr. Kotra has been working relentlessly to get an indication which makes economic sense, cost-wise, time-wise, and which has not been addressed before, to get our PEA into phase 2 clinical trials, which we hope to get hopefully by the end of second quarter. And then IND enabling studies are going for the psychoactive molecule called the Lucid Psych, and the molecule which treats progressive MS, and we hope to get both of them into phase 1 trials hopefully by the end of this year, if not the beginning of next year. But by the end of 2022, we hope to have 3 assets into different phase clinical trials.
That's great to hear. I really appreciate these insights today, Zishan. Thanks for coming out.
You're welcome. Anytime.
Awesome. And on that note, folks, if you ever have any questions, let us know what you think in that comment section below, and consider subscribing for those future updates as we continue to see this news come down the wire. But stay cool, stay awesome, and I look forward to catching you in the next one.